Today's episode is an interview with Dr. Eleni Mastro, an independent consultant pharmacist. I invited her on the podcast because she uses her voice to advocate and educate. You're listening to the Pharmacist Voice Podcast, a journey-style podcast about my career change from pharmacist to voice actor. I'm your host, Kim Newlove. I alternate solo shows and interview shows. The solo shows are about my career change, and the interview shows feature a variety of people who use their voices to advocate, educate, or entertain. I specialize in medical narration and e-learning. If you have a project in mind, contact me through my website, thepharmacistvoice.com. Thank you for joining me for episode 37. My guest today is Dr. Eleni Mastro. Optimizing drug therapy in the elderly is important. As an independent consultant pharmacist certified in medication therapy management, Dr. Mastro helps facilities and geriatric patients manage drug regimens, decrease adverse drug events, and reduce costs. As a result, her patients and clients feel empowered. Dr. Mastro's extensive background in pharmaceutical nomenclature and drug safety testing sparked her affinity to medication management. Dr. Mastro earned her Doctor of Pharmacy degree from the Ernest Mario School of Pharmacy at Rutgers University. She is an active member of the American Pharmacists Association and the American Society of Consultant Pharmacists. She is licensed in New York and New Jersey. Without further ado, here's my interview with Dr. Eleni Mastro. Hi, Eleni. Welcome to the Pharmacist Voice Podcast. How are you?
I'm doing very well. Thank you so much for having me.
My pleasure. I invited you on the podcast so you can share how you use your voice to advocate, educate, or entertain. How do you use your voice?
I use my voice to advocate and to educate.
Awesome. I understand that you have a history of using your voice in a very unique way, and I think you know what I'm talking about, and I'd love to hear about that first.
Yes, I can elaborate on that. I once worked in the branding industry for a company called Brand Institute, where we branded pharmaceutical products. And it's really allowed me to look at pharmacy nomenclature in a very unique way, even to this day. A lot goes into a name, as you may assume, but the most interesting for me as a pharmacist is the safety testing. Most people think of brand creation from the perspective of how a name makes you feel. And is it easy to pronounce? Does the name empower you in some way? Does it have some meaning to you? But the most interesting part for me, from the perspective of pharmaceutical nomenclature, is the final endpoint of the brand creation. How well does the brand work in real life? Does the name sound like another drug on the pharmacy shelf? Does the name look like another name when it's written by a physician? If it does look similar to another name, does it have the same milligram dosing? These are things that we look at when we're naming a drug that most people don't think of. So not only are you looking at how patients may feel about a drug, in which case you'd like a drug to be easy to pronounce, you'd like the name to be sexy in some way, but you also have to look at how well and how safe the name will be in practice.
This is fascinating. I did not know until I met you that pharmacists could have a hand in naming drugs. This is really interesting. If you don't mind my asking, how did you get a job doing that, helping to name drugs? As a pharmacist, a lot of us go into the traditional practice settings, community, hospital, and so on. I would not have thought to go into that. How'd you come up with that?
Well, I was in more of a traditional setting at the time, and a friend of mine just brought up an opportunity to me, and I just thought it was very interesting. You know, behind the pharmacy counter, you're seeing all the drugs on the shelf, you're seeing the way the bottles look, you're seeing the names, and there's always some type of design that is associated with it. So it just kind of drew me in, and I took the opportunity, and I really felt like I gained a lot. I gained a different perspective from it, and it was just very rewarding in many ways.
Was there a job posting somewhere, or was that something that your friend introduced you to? Hey, I work here. Why don't you come on over?
It was kind of both simultaneously. I knew that she had worked for the company in a different area, and I was speaking to her one day, and she did tell me about the opportunity, but I did see it online as well. So it's not every day you would see a listing for a job like that.
Good for you that you had that experience.
Thank you.
These days, I know you're doing something a little different. Can you tell me how you got from Brand Institute to where you are now?
Yes, I would be happy to. So I was working in the pharmaceutical branding industry, doing a lot of safety testing with the nomenclature. And I started getting into more of a clinical role, but I always thought that I had a unique perspective because of my extensive experience in naming and branding. And this is the reason I decided to, after many years of working in various clinical roles, I decided to start my own business and my own company. I wanted to reach people and really educate them on disease states in a different way than I was. With the elderly population at greatest risk from medication errors and non adherence, non compliance with their medication regimens, I really centered my business around them. I would like to consider myself as an advocate and an educator for the geriatric population. So far, it has been very liberating and rewarding for me. I've met some amazing pharmacists along the way. I actually joined the Pharmpreneur Academy with Blair Thielemeyer, and I just started watching her interviews. I was hooked, to tell you the truth. I was very inspired by her group, and deciding to come out on my own and just reach patients one-on-one, speak with their families, speak with their caregivers, and really just try to mostly educate them on their disease states, their medicines, why they're taking their medicines, why it's so important. And I just ran away with it. I also I work with assisted living facilities as well, doing consulting for them. And so far it's been great. I'm really open to any new opportunities that would come my way.
Great. Well, it sounds like you have a real passion for that. When you were working on safety data or learning more about drug safety, is that when you really realized you had a passion for what you're doing now, or did it develop in a different way?
Yes, working in safety data really brought out a passion in me because it did give me a unique look from a different perspective, really on really the end point of what this brand is going to become. Once you can create a brand, you can think the name is amazing, you can think the safety data is there, but until you see that brand working in real life, that's when you really know if it's good or not. And while I was working in brand creation, I had the unique perspective of having worked in the pharmacy setting. So I knew where those drugs were going to end up. I knew if that was going to work. I knew if it wasn't going to work in real practice. So that really brought out something in me when I went back to more clinical work. And I really looked at things a lot differently. I also had a patient many, many years back, and he came into the pharmacy and he was just complaining that his arm hurt. My arm's hurting a little bit. I just don't know what's going on. So I recommended, topical cream for him, put him in a brace. He came back about a week later complaining that the pain had gotten worse. So I told him, you know what, I don't have anything else to recommend to you. I just recommend that you see a doctor right away. I'm just not liking the way this sounds. So he did. He came back about a week and a half later with a slew of medications, and he told me that I saved his life. It was the only patient ever that had said that to me, and that really stuck. That really stuck, and that's, I guess, the real turning point for me was I really need to get down and speak to these patients when they have time, not when they're in a pharmacy, not when they're coming to see the doctor's office, not when they're in the hospital. Just need to sit down with them one-on-one and really discuss what's going on.
It sounds like that's really where you found your purpose. You helped somebody and that made an impression on you and you wanted to do more. Is that right?
Yes, that's correct. It's very important to me.
Tell me what's the name of your company and what it does and how patients find you.
Okay. The name of my company is Compliance Reach Pharmacy Consulting, and people can find me on my website. It's www.compliance-reach.com. I'm also on LinkedIn. I'm also on Facebook at Compliance Reach Pharmacy Consulting, and by email. I'd be happy to get an email from anybody. My email address is em@compliance-reach.com.
How do your patients find you?
My patients find me by referral, usually. I've had the amazing opportunity to work with many people in home care that would ask or refer patients to me. It's really a lot of word of mouth at this point, and some advertising I do on Facebook.
Do your patients find you from a distance or are they mostly in your local area?
When I started off, my patients were mostly in my local area. I had gone to certain businesses that I knew well and left my flyers there. A lot of pharmacies in the area too. I would work in especially one pharmacy in town. So I would put my flyers there and kind of reach out and network in order to reach patients, which I did. And once COVID hit, things changed a lot. And I did a lot of networking online and meeting a lot of people with Zoom calls and things like that. And I was able to reach patients in that way as well.
Hit them from all angles, right? That's all right. If you want to help people, any way they can find you and you can reach out to them is valid.
Exactly. And, with things changing all the time, you need to kind of reinvent yourself and find new ways of reaching out to people.
What services do you offer, and how did you narrow it down to just those services?
That's a really good question because I think in the beginning when I set out to open my own consulting company, I was a little unsure, who should my target audience be? Who do I want to reach out to the most? So I just kept thinking, what's the biggest need out there? And I felt like with the growing elderly population and this population really at the most risk of medication errors, hazards, I started to narrow down on disease state management in the elderly as well as education. I was always big on education because I feel that when people understand and are educated on their disease states, on their medications, it empowers them in various ways. And I really see that in practice now. So that's kind of how I narrowed down my services. I felt like the population was in the biggest need and I can make the biggest impact in these patients.
Really, you're educating them, but then they become an advocate for themselves once they know more about it.
Right. And it's really great to see it happen real life. People do get empowered and it brings out a lot in them. Just getting somebody to go out and walk and go for their daily walk. And I see what it does for them. It's not only good for their health, but it's good for their mental well-being as well.
Absolutely. Could you tell me a success story with your private practice? I know you mentioned the gentleman earlier from a previous job setting that you had, but now that you're in private practice, could you tell me a success story?
So I was working with a very nice elderly gentleman with dementia, and I was working with his family as well. And they called me up one day. They were very concerned that he hadn't been sleeping well, and his behavior just became very bizarre, and his symptoms of dementia had just gone downhill, as they called it. So I spoke with them a little bit, and the first thing I wanted to do was figure out why he's not sleeping, because I felt like his lack of sleep was really contributing to his symptoms getting worse. And through speaking to them, we did figure out a way to get him sleeping better. And one thing that I felt as well was that he really needed to get up and walk around. He was just in bed all the time, unable to sleep, and he was getting very annoyed. I would get very annoyed if I couldn't sleep and I was sitting down all day. So, I discussed with him about the importance of getting up, walking around. Let's try to take a walk. And you know what? About 2 weeks later, when I followed up with him, he was just feeling better. His symptoms had subsided, and the whole family was sleeping better and much happier.
I love a good success story. Would you say that you even intervened with his medications much, or it was more of a lifestyle change that you encouraged?
Well, when I first work with patients and their families, I really look at all the medications. And what I try to do, kind of like putting pieces of the puzzle together and taking pieces of the puzzle apart. I really try to see, are these medications warranted? Are there any medications that we can take off of this list? I certainly don't like to see a lot of elderly patients on proton pump inhibitors, for instance, because I feel like they can lead to a whole slew of other things. So I did help him with his medications, and we kind of streamlined the times of day he was taking certain medications. And I do believe we were able to get rid of one medication as well. And, really get him on a schedule, taking certain medications, breakfast, lunch, and dinner.
Very good. You must be very familiar with the Beers criteria, the Beers list, right?
Yes, very much so.
Yes. How does your familiarity with the Beers list help with your business?
I really feel like that's what it's all about. I'm really up to date on the Beers list. Really, from the perspective of the elderly population, there's a lot of medicines that you wouldn't want them to be on to begin with. So I'm always going by that list to see what's warranted, what dosing is warranted. I also speak with a lot of physicians to try to get the blood work, because looking at the blood work as well, I can make recommendations on what medications are appropriate at what doses, what medications maybe we can change to a safer alternative. So it is a very good question. Because I believe that a lot of what I do and a lot of consultant pharmacists as well is really go by the Beers list and the updates that occur to make sure that we're making the appropriate recommendations.
Some of my listeners may be unfamiliar with the Beers list. Could you please tell my listeners what the Beers list is and why it's important to the elderly?
The Beers criteria are really a list of potentially inappropriate medications for the elderly. And the list and dosing of certain medications is really done by a lot of clinical trials that come out. And the Beers list is updated according to any new literature that comes out regarding certain medications and disease states. So it's quite important to keep up with the Beers list and the latest criteria while you're treating patients.
Well said. Yeah, there are some drugs that are inappropriate in a certain age group. And just knowing that and helping other pharmacists remember that those conversations are important is critical. Thank you for bringing that up.
Thank you.
We talked about the Beers list a little bit. Are there any other resources that you find yourself using often?
So I get a lot of my resources from the ASCP. I've been a member for the last several years. It's the American Society of Consultant Pharmacists, and there's just so much information. And there's a lot of other consultant pharmacists that you can meet through the website that can give you advice. There's a lot of CEs, and I feel like I gain the most knowledge and education from that site, because it's more specific for the geriatric population as well, and any disease states and how to manage them in the geriatric population.
Yeah, that's a good fit for you. I can see why you use that.
Yes, I'm on the site quite often, just trying to look at new things, new resources, and it's really been great. They do a great job.
When you go to the ASCP website, are you looking for webinars? Are you looking for something to read? Is there a podcast you listen to? I'm just curious. How do you prefer to consume your CE?
Well, what I do the most on the site, I think many years ago when I was first interested in becoming a member, and I had become a member at that point, I would go on the site and just look for resources. And in the beginning, I checked to see, they do have a section on Meet a Pharmacist, and they do have about 10 pharmacists or so and their backstories, and they're all doing kind of different things. And it was just intriguing to me. So I just went on and I read every single one of those bios so I can see what are people doing. And I think that's another reason I had gone out and started working with medication management with the thought to go into consulting as well. And I was reading a bio on a woman that had done just that. And I just felt like a lot of what her background was parallel to mine. So in the beginning, that's what I was doing. Most of the time I go on now is to find out the latest information. There's a lot of COVID information on there as well. And I do a lot of their CEs, just anything related to geriatric care, even managing diabetes in geriatric patients. They have a lot of information on transitional care management, which is something I'm a very big advocate for, because I feel that is another big need in the healthcare industry, is the patients that are transitioning from the hospital to home or to various different sites, back and forth. So they have a lot of information about that, a lot of webinars and CEs. So I would really suggest that anybody that is interested in working in geriatric care, go out and become a member of the ASCP. They really have a lot to offer.
Great advice. And you brought up some very timely topics: COVID, transitions of care. A pharmacist could make an entire business off of transitions of care.
Right. And I wholeheartedly believe that. And a lot of what I do is, I'm not specific for transitional care management, but everything that I do keeps that in mind. So I'm working with patients. Did they just leave the hospital and come home? When I'm working in assisted living, they're obviously going from home into the assisted living community, and they may have gone to the hospital and back to assisted living. So I pay special attention to those patients and their management of their medications, because I know that there's a lot of miscommunication, a lot can go wrong. So everything I do has a little bit of that in mind.
Well, it sounds like you've gotten a lot of good advice over your transition from Brand Institute to all the way till now. Can you tell me what's one of the best pieces of advice you've had?
Funny enough, one of the best pieces of advice that I can think of is somebody many years back told me about imposter syndrome. And it was kind of a new term to me. And I'm thinking, imposter syndrome, what does this mean? And I delve into it a little bit and I realize I may have imposter syndrome. When you don't believe in yourself, or maybe not even realize that you can do what you aspire to do. And I think it was another turning point for me. It was really the best advice I had ever gotten, was to just push aside anything that would tell me I can't do this. And I just ran with it and I didn't look back. So it was very good advice. And it's advice that I would give to anybody as well.
I did not know about imposter syndrome until last summer, and I kept having these thoughts. Who are you to do this voiceover thing? And I had a friend who's a pharmacist and also in the voiceover industry. His name's Mike. And he said, you're experiencing it. Just be aware of it and you need to push through it. And the advice you gave just a moment ago is the same advice he gave me. Anyone listening to this, if you're thinking, I can't do that, I can't build my own business, you can. Other people have done it. Eleni's one of them. Be inspired.
Exactly. Be inspired. Listen to as many interviews as you can, and if you are passionate about something and you really want to do it, you really can do it. And I think that if you have any imposter syndrome at all, whether you know the term or not, push it aside and just keep going.
Eleni, what's one of the biggest challenges you've had to overcome by being an entrepreneur and having your own business?
I think one of the biggest challenges I had, aside from trying to really hone in on who my target audience would be, was really communicating to patients about medication management, because it's fairly new to patients, even though it's been in the pharmacy industry for so long, really to get them to understand how important it is. So I kind of felt, not that it was a big roadblock in the beginning, but I would basically say to patients, let's give it a try. If you don't feel like I can impact your life in some way through managing your medicines or helping you understand your medications, then I'm not going to charge you for this service. And I felt like it was one of the biggest challenges in the beginning, but it also got me thinking of things in a different light as well. How am I going to market myself? Maybe I should be trying a different angle. So, things like that could be challenging, they can also be a blessing.
I know what you mean. Getting patient buy-in can be tricky.
Right.
Yeah, you're offering the solution to a problem they don't realize they have.
Exactly. Yeah, and I kind of felt that in the beginning, and I thought that it may happen, working in a retail pharmacy for some years as well, and we did do medication management there. People don't have time for it. Sometimes you would call, how are you doing on your medications? How are you feeling? Do you have any questions? And they would say no, but deep down, they may really not be understanding something, or not taking a certain medication because they didn't know why they were taking it, or they had an initial side effect from a medication they didn't know would subside if they kept taking it, and that they would feel better after 4 to 6 weeks when they're expecting to feel better after 2 days. So it's something that's needed, and you have to just be very creative in how you market yourself, how you discuss the services with patients, to really get their buy-in.
What's the best thing that's happened since you started your own business?
I think the best thing that's happened to me while starting my business is the amazing people I met along the way. I really have to say, it's the patients, it's their families, it's the other pharmacists, the other entrepreneurs that I've met along the way. That has been the most rewarding to me, just reaching out and meeting people. And even with the whole COVID thing that we had discussed earlier, just switching to meeting people virtually. And you can really reach out to more people in that way. So I have to say, the answer is short and sweet. It's just the amazing people along the way that I've met have really impacted me in so many different ways.
That's great. As we wrap this up, I just want to know, is there anything else you'd like to share?
I just wanted to say that my company, Compliance Reach, is a medication management company specializing in the geriatric population. I work with patients, caregivers, families. I work with assisted living facilities, nursing homes, and really an easy way to get in touch with me would be to come to my website, www.compliance-reach.com, or email me at em@compliance-reach.com. I'd be happy to have a conversation with anybody that is having a little trouble managing their medications, or for an elderly parent, for instance. You can send me an email, you can contact me on my website, and really right away I would like to get in touch with you and have an introductory call, discuss any concerns you may have, and really anything that's needed. I also work with facilities if they are in need of a consultant pharmacist to help manage medication therapies there. I give educational seminars as well, and just happy to get my voice out there and reach as many people as I can to help them and impact them in some way.
Eleni, thank you for being on the Pharmacist Voice podcast and sharing how you use your voice.
Thank you very much. It's been a pleasure. Thank you.
Thank you for joining me for episode 37 of the Pharmacist Voice podcast. Please visit thepharmacistvoice.com to subscribe and read the show notes. That's thepharmacist with an S, voice.com.